groundbreaking research output is a commitment to improving lives and understanding the real-world changes facing our communities. For 37 years, the KEMRI-Wellcome Trust Research Programme has been defined by research excellence, meaningful impacts, and a people-centered approach to science. It has nurtured and empowered the next generation of African research leaders, building a legacy that extends far beyond the laboratory. Over the decades, the program has carefully built the foundations that sustain world-class research, pillars that support rigorous science, collaboration, and innovation, aimed at solving real-world problems. The result is knowledge that does not remain on paper, but moves into practice and policy. Our influence can be seen where it matters most, from improving the care of severely ill children to shaping county health policies across Kenya. KWTRP is a long-standing partnership between the Kenya Medical Research Institute, KEMRI, Wellcome, and the University of Oxford. The program has hubs in Kilifi and Nairobi, Kenya, and Mbale, Mbale and the Mbale Clinical Research Institute in eastern Uganda. We are hosted at the KEMRI Center for Geographic Medicine Research Coast.
Our mission as KEMRI-Wellcome Trust is to conduct high-quality, innovative, and purposeful research that improves human health while building research capacity and leadership within Africa. Our research is structured around 5 key themes that are interrelated and multidisciplinary. This includes infectious diseases, vaccines, maternal and child health, emerging health threats such as antimicrobial resistance, climate and health, and non-communicable diseases, and mental health, as well as health systems. The research that we do is supported by an integrated research platform that includes a Kilifi demographic and health surveillance site, which collects data routinely from about 300,000 individuals within Kilifi. We also have state-of-the-art bioscience laboratories and a biobank that supports the bioscience work that we do. We have a clinical trials facility and a clinical team within the Kilifi County Hospital that supports our observational clinical work, clinical surveillance, and clinical trials. We also have a network of hospitals that provides a platform for hospital surveillance, observational clinical research, and pragmatic clinical trials that brings together about 24 public hospitals across Kenya that we call the Clinical Information Network. And lastly, we have an engagement platform that supports public, community, and policy engagement. Over the next 5 years, our strategy is underpinned by 3 key strategic anchors. This includes impact, sustainability, and culture. We are keen to drive impact in health research through various strategies that includes tightening the link between the science that we do and local and international global health priorities. We are also keen to reorient our geographical focus from a focus on just Kenya to an international and regional focus so that we can scale our impact. And lastly, we are quite keen on deepening translation so that we can move our science from just discovery to begin to think about product development and getting products into the market. For us to be able to strengthen sustainability, we are going to have a focus on both financial sustainability, environmental sustainability, and operational effectiveness. And lastly, we want to build a culture that is collaborative, a culture that is inclusive, a culture that is safe and respectful, to create an environment that can enable our scientists to be able to do their work and to thrive. Our strategy has 5 key objectives. One is discovery and development. Second objective is around interventions. Third objective is on surveillance and metrics. Fourth objective is on access and quality. And lastly, on capacity building. With the first objective on discovery and development, we are quite keen to advance discovery science and to develop those discoveries into interventions that have high impact in terms of population health. With regards to intervention, we want to generate evidence that can inform the introduction of health interventions that are safe and effective and tackle priority health diseases. For surveillance and metrics, we want to generate high-quality, multi-level surveillance and metrics data that can inform timely public health action. And lastly, with regards to access and quality, we want to advance knowledge that will improve the delivery of equitable quality healthcare services to our populations.
Our work supports the introduction of safe and effective interventions for priority health challenges, while also promoting fair access to quality healthcare for all.
So we have an ambitious plan over the next 5 years, but we cannot do it alone. For us to be able to do this, it's dependent on the partnerships that we have. Key amongst these partners include our policymakers, our implementers, frontline health workers, and communities. Our funders are also quite an important component of our stakeholder network. And lastly, a network of research collaborators within the country and across.
Together, transforming research into healthier futures.